there, Suzanne Kellner-Zinck, Donnie Vision's Hypnosis. I've been in the field of mental health since 1993, professionally. But I really entered the field of mental health being born from a woman who suffered with borderline personality disorder. Yes, she was diagnosed. Generalized anxiety, and when she got to the nursing home, they added bipolar 2. Being raised by such a person can teach you things if you wanted to. I have 4 sisters. They have not overcome some of the things that happened to them 40 and 50 years ago. My sisters are in their 50s and 60s now, as I'm 63, and I'm right in the middle of the group. There's 12 years between all of us. What I want you to understand is that many of the things that we're told and taught regarding mental health and mental illness are totally untrue. Why do I say this? Because having been in the field, both as a client and as a provider, both in conventional mental health and in the hypnotic arts, I can tell you that there is a really big difference between the results that the hypnotists are able to get for their patients and clients than the mental health providers that are legally pushing drugs that are mind-altering and causing a lot of problems in the Western society, most especially in the United States, where mass shootings are happening too often to count. And I know a little bit about this. I'm not an expert by any stretch of the imagination, but I did do a very long research paper as a capstone project for my medical sociology degree called What Makes a Mass Shooter a Mass Shooter? So it happened the instructor for that program was a mental health provider and very interested in what I was going to find through my research. And what I found, and what other researchers in academia have found, even more recently, is that handing out amphetamines to kids who are unable to sit still, because it's not a normal thing for a kid to sit still for 6 to 8 hours in a schoolroom, giving SSRIs, serotonin reuptake inhibitors, that have a black box warning on them, by the way, because they cause homicidal and suicidal thoughts in teenagers and college-age kids. Yes, homicidal thoughts. And we wonder why we have mass shootings happening all over the place. And antipsychotics to very young children. We take that and we couple it with endless counseling. Do you know where this idea of endless therapy sessions came from? I'll tell you where. I found out as a process of reading through the index of the first text I received for my doctorate in psychology, PsyD degree. Chapter 4 had a wonderful history of hypnotism, better than any I had in any of my hypnosis trainings, to tell you the honest truth. And in there they explained how Dr. Sigmund Freud, who sucked at hypnosis and understood that, he was actually trained by some very wonderful people at the Nancy School, but he couldn't get the hang of it. And as Freud did with too many things, he sexualized it, making it something that he didn't want to be a part of. In any case, interestingly enough, he created psychoanalysis so that he could have his own process to market. Sound like other marketers out there who have all their own little names for what their little processes are, even though it's the same stuff, just called by something new and different? And that's why we have endless therapy sessions that reinvigorate the traumas, because they are working in the prefrontal cortex of the brain. We know this because of the brain scans that have been done by people in the hypnotic state over the last, 5-10 years. Hypnotism goes to the subconscious, the unconscious mind. the amygdala, where the emotions reside, and the hippocampus, where the memories, although they're totally imperfect, because the younger you are less likely to be able to reason, rationalize, or judge anything. It's just taking in information and taking it literally, which is why when you tell a young child something, they take it literally. They don't understand nuance until they get a bit older. And why it is that your teenagers do impulsive, stupid crap. Their prefrontal cortex is not fully developed yet, so stop expecting them to be mentally an adult when they're only a teenager or 20-something, not yet fully developed. They're not fully developed until 25 for females, 26 for males. I don't know why the difference, but that's the way we have found it through research. So how about we understand that mental illness, for the most part, not all of it, because some of it is physiological, and this is why I would love mental health people to learn about the physiology of the body and how nutrition plays a really important part in how all this stuff works. There's a few people out there who are actually teaching about this pretty regularly. And we can have hormonal imbalances. I sent several of my clients who needed hormonal balancing to my compounding pharmacist, where he was a specialist in sex hormones, did the testing they needed with the saliva, not the blood, and compounded their hormones for them so that they were no longer severely depressed. And really the whole idea of genetic mutation, which caused one of my clients, apparently, who received a genetic mutation on both sides of her family, her mother and her father, this was her big problem. It took forever first to figure it out, but finally the integrative doctor that I sent her to figured it out, and now she's getting the supplements she needs so that she can feel normal and healthy again. So how do you deal with this? We need to understand that the reason for most emotionally based problems is trauma, emotional trauma. Our subconscious, unconscious mind develops defense mechanisms to keep us safe in these situations where we don't feel safe. And then we outlive the need for those self-defenses, and that's when we have dysregulated emotions, dysfunctional thinking in general, and behavior that may feel self-medicating, but can be very disruptive to our quality of life. What I'd like you to all understand is this. Theories do not heal. Getting to the root cause of the problem does. And my main mission, movement, is to get mental health practitioners to learn how to help their patients heal. Because I don't know about you, but I'm sick of being asked to donate money to find a cure for cancer when mentally ill people are told endlessly that all they can do is manage symptoms through toxic medications for the rest of their lives, usually for depression and anxiety, where neurolinguistic programming can help get rid of these problems very easily and effectively and forever without any toxic medications. I know I've been doing it for 23 and a half years at this point when this is being recorded. And endless sessions just make people more upset because you are not using the altered state of mind as hypnosis does, so the person is brought back into that event, reinvigorating the feelings that they had, and then therapists wonder why their patients don't heal. This is why they don't heal. And by the way, most of these so-called medications, if you look at how they're tested, you'll notice that they're tested generally on college-age boys, which doesn't tell us how it works on younger people, older people, and certainly children. His metabolism is a lot different than that of a teen or 20-something-year-old male. The reason they use those age groups is because they're college students. So we need to understand who is being studied for what med, and do the results actually tell you anything? Because I'm going to tell you right here. In my medical sociology degree, I had to write a lot of papers, which required a lot of reading of even more papers to write the academic papers that I had to hand in. And you'll find that the results don't necessarily back up anything of what they are saying these drugs can do. But because you don't understand how to read these papers, you don't understand that. And I'm not even the best at reading this stuff, especially the quantitative stuff with all the statistics and all the charts and everything. But there's enough information in them that we can understand what is real and what is not real. And it's about time we understood that we have the capacity within our own minds and bodies to heal, so long as we go to the cause of the problem. And by the way, we've known how to help people with emotional problems since the 1700s with hypnotism. But Sigmund Freud decided he had a better way. And because we have the capture by Big Pharma to make diagnoses for every normal human emotion these days, it's like they create the diagnosis and then they decide what medication to give, usually anti-anxiety, antidepressant type of drug. Most anti-anxieties are antidepressants, SSRIs generally speaking. And they don't work. And you know they don't work because you see it in your practice every freaking day. If you were to actually look at the proportion of patients that you have who are on medication, and you notice how they're doing on their medications, you'll notice the very few who are doing well on them and the very many that are making marginal gains to no gains and complaining endlessly about side effects. Everything from just dry mouth and other annoyances to neurological problems, which happened with one of my clients, actually. So I'd like you to rethink how you go about thinking about what you're doing with your patients. I'm going to be adding a lot more videos like this one to tease out how we can better help our clients and patients heal based on the knowledge that we've had for centuries. That has worked for millennia, actually. If you think about Dr. Braid over there working for the East India Company, for the British Army, doing amputations of injured soldiers, merely with hypnosis. We didn't know what bacteria was back then. We didn't have any anesthetics. This is all they had. He had a 95% success rate with his patients doing fine after the amputation. With hypnosis. No anesthetic. For those times, there was nothing. People just had to deal with it, the pain that came with the surgery. That was it. Maybe get a little liquor, who knows. But these are the realities of what we're dealing with here. And my movement is about having healers heal. And I want you to know that you have the ability if you're willing to learn how to do this for your own patients and clients. Because you can do it. You just have to learn the techniques that work. But it's only going to be beneficial, number one, if you actually want to see your people heal. And number two, are willing to hold a space for them to heal by acknowledging the fact that what you've been doing up to now doesn't work. Not really. Because if it did work, your patients would have to see you week after week and remain on medications forever. That's management of symptoms. That's not healing. So I want to thank you for your time. Until next time. Bye-bye all.